So if you or your wife were sick with a life-limiting illness in the hospital, before you leave, I would ask for a palliative care consult. If the prognosis, the amount of time they have left to live is less than a couple of years, it's perfectly appropriate to speak to somebody in palliative care so that you can get the emotional, spiritual support when you leave. And the main difference between palliative care and hospice is that in palliative care, you can continue all of the life-saving treatments that you want. If you have cancer, you can absolutely continue chemotherapy, radiation, whatever medications are going to hopefully extend your life. In hospice, you've made a decision. I don't want to go back to the hospital anymore. I don't want to keep doing dialysis. I don't want all these efforts that are draining my energy. I'm short of breath. I want to be at home and enjoy the time I have, watch the birds and the deer, enjoy my grandchildren, get to that wedding that's in 3 months. Hospice usually needs a prognosis of 6 months or less.
Mhm.
People are referred through a doctor's order. We have different hospice beds all around Rochester, and most cities in America do. There are hospice beds in hospitals. There are hospice beds in skilled nursing facilities, nursing homes. There are hospice beds sometimes in comfort care homes, which is what we have several of in Rochester.
Hmm.
And so a referral can be made, and it's usually a social worker, if the person's in the hospital, would be speaking to the family about where is the best place for your loved one to spend their final days. And I've worked in comfort care homes in Rochester. Referrals can be sent there. They can be
Mhm.
sent, as I said, to a nursing home. And so once the referral is made, uh, there's a process, there's a screening if it's going to be a comfort care home. If someone wants to die in their own home, usually the hospital will make sure that it's a safe discharge plan, that there are people at home to take care of you.
Is
And
there such a thing as an in-home hospice?
well, a comfort care home has 2 beds in Rochester. We have them throughout many of our towns. To be in your own home, it's just considered hospice care at home.